What is a lipoma?
So a lipoma is a small, benign, fatty tumour. So that means it's a collection of localized fat cells, okay? And they're usually present in just beneath the surface of the skin in most cases, and they may be presenting as a sort of soft, fatty lump beneath the skin, usually painless, but they can grow quite large, and they can occur anywhere on the body, albeit the face, the scalp, on the body, and they're quite easily removed by a simple minor surgical procedure to dissect that little fatty lump from beneath the skin. And so we remove a lot of lipomas at Skin Excellence clinics.
What is a skin cyst?
A skin cyst is usually a blocked gland or blocked oil gland within the skin. So we have oil glands that produce oil, usually attached to hair follicles. So they can often occur anywhere on the body, the scalp, the torso, the chest, the body, where there's hairs. And they will present as a small, firm lump that can slowly increase or rapidly increase in size. They're usually just beneath the surface of the skin. Sometimes they will discharge themselves and sebum or oil will come out of the gland, but often they don't. And sometimes they can get infected, become very red, and need more urgent treatment if they become infected. But most of the time they are simple, firm lumps beneath the skin. And they can cause some discomfort, but most of the time it's it's the visible appearance that people dislike of these small cysts. They're very easily removed by minor surgical procedure, by excising the cyst and removing the whole of the sac of the cyst. And that's a simple procedure that we can offer at Skin Excellence clinics, and it's undertaken in our surgical facilities with just simple local anesthetic injections.
What is a dermatofibroma?
A dermatofibroma is a small fibrous or scar lump within the skin. It presents, often they can occur following a little minor trauma to the skin. It could even be an insect bite or a small splinter, following which there will be some inflammation within the skin and the tissues, and eventually that inflammation will lead to a little firm, hard lump, almost like a little pebble within the skin. And they're usually small, and they're very easily removed surgically by cutting that area of skin away with the dermatofibroma within the lump and stitching it back up again to give really nice healing. And this is something that we do quite frequently at Skin Excellence clinics in our minor surgical facilities, which we have with our surgically trained doctors. So if you have a dermatofibroma or you're unsure, then it's worth getting a diagnosis first, either with your GP or coming and seeing us at our clinic to diagnose whether you have a dermatofibroma and whether we can remove that for you simply with our surgery.